Myriad Genetics' latest survey reveals a major knowledge gap. Most women don't know that dense breast tissue may raise their cancer risk. And joining us to discuss how to bridge this gap and ensure women are equipped with the information they need for early detection are OBGYN Dr. Ifeyinwa Stitt and breast cancer previvor Ashley Dedmon. Good morning to you both.
Good morning. How are you this morning?
We're doing very well, thank you here. Now, Dr. Stitt, can you explain why breast density is an important factor in assessing breast cancer risk and how it complicates early detection efforts?
Happy to do so. First of all, thank you so much for having us. And it's the first day of Breast Cancer Awareness Month, so such an important and timely topic. Now, when we talk about dense breasts, first I want your viewers to know that this is not an abnormal finding. Up to 50% of women do have dense breasts, and it's not abnormal. That's the first thing. Now, when we talk about dense breasts, we're not talking about what you can see or what you can feel when you look at yourself in the mirror. What we're talking about is what it appears like on mammograms. On mammograms, dense breast appears white, and that's just because of the glandular, the type of tissue that's there. But the problem is, so do things that are associated with cancer. Calcifications as well as tumors will also appear white. So it makes it a little bit more challenging for your radiologist to interpret the mammograms of women who have dense breasts. Additionally, in the tissue that many women who have dense breasts have, it's oftentimes cancers will develop in those areas, in those fibrous or glandular areas. So it just provides a bit of an extra challenge for the radiologist to interpret the mammograms of women who have dense breasts.
Yeah, Ashley, based on your experience, how did learning about your breast density impact your approach to screening and prevention?
Learning about my breast density and my BRCA2 mutation changed my standard of care. I began screening earlier at the age of 21. I also had to increase the frequency of my screenings as well as the various modalities of my screening. So breast MRIs, breast ultrasounds, in addition to mammograms, as well as transvaginal ultrasounds to monitor my ovarian health. Understanding these risks pushed me as an advocate to be able to advocate for equitable care as well as the best technology available.
Dr. Stitt, what would you say to those who might be unsure about the significance and importance of annual screenings?
I tell my patients all the time that having regular breast checks allows me as a provider and allows the radiologist to become familiar with one's breasts. And this way we can determine those patients that might need supplemental screenings, and some of the ones that are mentioned by Ashley. The other piece of it is family history. That is an absolutely vital piece of information that will help to determine those patients that might be at higher risk. The test that I use is the MyRisk Hereditary Cancer Test with Risk Score. I personally choose that test because it's the first and only test that has been clinically validated for women of all ancestries and ethnicities. Most of the genetic testing that's been created and done in the world has been done for women of European ancestry. So that means that Black women or Latino women, women of Native peoples, these women do not have the same access and don't have the same, can't be as reliable. These tests are not as reliable for those type of patients. So this is the first test that makes a level and even playing field for women of all ancestries.
Yeah, Ashley, how did the genetic testing play a role in your journey, and what peace of mind did it provide to you?
Genetic testing really helped me to understand my risk, giving my family history. My mother had metastatic breast cancer, father had prostate cancer, and he's a survivor. The Myriad MyRisk provided insight beyond what I could see or feel. It gave me a roadmap to monitor my health through early initiation to screening, through lifestyle changes, and the decision to have a preventative double mastectomy at the age of 31. Finally, it helps me to have conversations with my family and my children about their potential risks, so that they too can make informed decisions about their health.
Well, thank you so much to you both, Dr. Stitt, for the information, and Ashley for your bravery and for sharing your journey. Have a great day. Thank you.
You're so welcome. Have a great day.
To learn more about the study and find resources for early detection, be sure to head to getmyrisk.com.